This piece that came out in the Lancet last week, obviously showing variations and differing factors that influence vaccine confidence across different countries in the world. In your piece, really advocating for obviously everything happening right now in COVID-19, that this is the time that we need to address these disparities in issues, correct? Could you expand a little bit on your perspective, at least in terms of overall vaccine confidence?
Well, so in 2019, the World Health Organization declared that vaccine hesitancy was a top 10 global health threat. And I think this was based on a lot of things. Measles, probably the biggest driver. We've seen in Europe huge outbreaks, tens of thousands of cases. And in the US, we've seen reoccurring outbreaks. And the story in the US is really very consistent, and it has been for past decade. You have communities where enough people are not vaccinating, refusing vaccines, largely because they're concerned about the safety. And they are clustered geographically, they're clustered socially, and then somebody introduces measles. It's an international importation. Often it's coming from Europe, though there's lots of measles in Africa, there's far less airplane travel, and there's lots of measles in Europe. Somebody from one of these communities goes to Europe and comes back, or somebody from Europe visits. And it's not just Europe. We saw a huge importation from the Philippines as well. But it introduces measles into one of these communities. We see an outbreak. Public health responds with testing and contact tracing and isolation. You know, the Disneyland outbreak caught a lot of attention. The New York outbreak caught a lot of attention. And in fact, in 2019, we almost lost our elimination status. It's different from Europe. In Europe, they're just having huge ongoing outbreaks. The numbers of cases are orders of magnitude higher. But we see this globally. We see with other vaccine safety scares. Often they are ultimately not supported by science, but there's exceptions. You know, for example, if you look at the dengue vaccine, which was discussed in the article that you mentioned, there was a real problem with the vaccine, and it bled over to trust and confidence in other vaccines as well. So it's really in this climate that we see COVID, and we see the potential introduction of a COVID vaccine coming down the road. And it's exceedingly challenging because we already had huge problems with vaccine hesitancy. And at least in the US, we see a real separation between those that understand, believe in, accept science, and those that are dismissive of the most basic scientific facts. We see a polarization based on politics, and things as simple as, you know, wearing a mask have become politically hot issues, and substantial proportions of the population refusing to do so. So it's a very challenging situation we see right now.
Yeah. And in terms of, if we're looking at vaccine hesitancy, obviously it can vary case by case. You know, some of the anecdotes that I hear from, you know, my peers and others as to why they don't want to get, say, the seasonal flu vaccine may differ from the opinions and perspectives regarding, you know, pediatric and infant level vaccinations for their children, right? Are there more comprehensive, I guess, more greater overlapping factors that are influencing vaccine hesitancy beyond just misinformation and communication of such misinformation?
I mean, as you point out, it's very vaccine specific. It's very disease specific. It's very also regionally specific, whether it's country or within the country. And it varies by time. I mean, flu is a great example. We have very, very safe vaccines that are moderately effective compared to other vaccines who are not that effective, but they're still not bad. And yet we see rather poor uptake. We see lots of misinformation around flu, from the flu vaccine can cause flu, which it can't, or flu is not that serious, which it certainly can be. I think part of the problem with flu is that people and clinicians will often use flu as a generic term. So when they say flu, they mean like a cold, like a winter cold. Actually, it might be a coronavirus, right? So somebody gets the flu vaccine and then they get a cold. They get some other winter illness and they go, oh, I got the flu from the vaccine. And they didn't. Or they think the vaccine didn't work. And in fact, they didn't get influenza. They got some other perhaps respiratory virus. And so, that's part of what's going on with the flu. I think that it's being required annually doesn't help. I mean, the flu is not one of our best vaccines, and people have been trying for a long time to come up with better vaccines. HPV is another example. It's a great vaccine. It's very safe, very, very effective. It's a disease that impacts a large number of people, yet coverage is poor in the US, and especially compared to other developed countries. And the issues there are also somewhat specific to HPV. And I think it's largely how the vaccine is perceived by parents, by clinicians even, and it's viewed as a disease that is sexually transmitted, which is odd because other diseases we don't describe it by the mode of transmission, but it kind of makes HPV off on its own. And we've again seen very poor coverage. So these are all specific to diseases and vaccines, and they can change over time. They can be different between countries. Many developed countries have excellent coverage for HPV vaccine.